Applying Cellulase on the abdomen does not require any anesthesia. Define the area with a dermographic pencil. To do it manually, pinch the skin to make a roll of fat and stretch to minimize any risk of pain. The procedure is the same with the mesotherapy injector. Set the injection depth to between 8 and 12 millimeters. Stretch the skin with the hand. The needle is inserted to a depth of between 8 and 12 millimeters to inject cellulase in the adipose cells responsible for fat storage. Cover the whole area to be treated. Lie the patient on their side. The leg to be treated is extended. Define the area with a dermographic pencil. A line along the thigh from the top of the thigh to the bottom of the hip. A line from the upper part of the thigh to the buttock crease. A line from the buttock crease to the lower part of the hip. Set the depth of the injection of the mesotherapy injector to between 8 and 12 millimeters. Inject every 1 to 2 centimeters with 0.1 to 0.2 milliliters per point. The needle penetrates deeply to inject cellulase to the layer of adipose cells responsible for fat storage. Cover the whole area to be treated. Applying cellulase on the hips does not require any anesthesia. Ask the patient to be seated. To determine the area to be injected, hold the patient's arm out horizontally. The loose area is defined with a dermographic pencil. Set the depth of injection of the mesotherapy injector to 4 millimeters. Inject every 1 to 2 centimeters by stretching the skin with your free hand. Applying Cellulift on the inside of the arms does not require any anesthesia. Cellulift can also be applied manually with the point-by-point technique. Injections are done with a 4 mm needle with 0.1 to 0.2 milliliters per point. Inject every 1 to 2 centimeters while stretching the skin. Applying Cellulift on the abdomen does not require any anesthesia. To determine the area to be injected, do a pincée roulé on the abdomen. A roll of fat is revealed where the treatment is necessary. Define the area with a dermographic pencil. Draw lines from 1 to 2 centimeters apart. Set the depth of injection of the injector to 4 millimeters. Inject every 1 to 2 centimeters by stretching the skin with your free hand. Cover the whole area to be treated. Should slight bleeding occur, simply apply light fingertip pressure. Disinfect the area to be treated. Slightly bend the needle, bevel upwards. Press the needle against the skin. Create papules by injecting 0.05 milliliters of Hydractive or Hydractive in Cellulift per point. Separate the papules by about 0.5 centimeters. stretch the skin to facilitate the injection. The injections are very superficial. The skin around the neckline often loses its firmness. Therefore, greater quantities of the product are injected than on the face. The papules are more visible and will disappear within 24 hours. The formation of the papules is visible at each injection. The most sensitive area of the neckline is the lower part. At the end of the treatment, massage the treated area with a moisturizing cream. The massage will spread Hydractive evenly and rapidly smooth out the micropapules. When applying Cellulise on the face, it is recommended to use an anesthetic gel. Seat the patient with their head tilting slightly backwards. Slightly bend the needle, bevel upwards. Inject point by point at a depth of between 1 and 2 millimeters. Inject every 1 to 2 centimeters while stretching the skin. Cover the whole area to be treated.